Hi there, it's Dr. Kandola at Skinhance Aesthetic Training in Cardiff. Just going to talk a little bit about the thread lift, also known as a non-surgical facelift. This procedure will last typically between 12 to 18 months, giving a really nice tightening of predominantly the jawline, the jowl area, pulling back potentially the sagging nasolabial area back to where it should be at the cheeks, giving some cheek volume. It's very good for people usually in the late 30s, early 40s to mid 50s, late 50s age bracket, and provides an excellent adjunct to treatment such as Botox or botulinum treatment and dermal fillers. Today we'll be doing a non-surgical thread lift using intraline product, using the 19 gauge threads. We'll talk a little bit more about that in the actual procedure itself. But something about the threads themselves, they're called PDO threads, which stands for poly-P-dioxanone sulfate, or polydiaxanone, or just PDO. So you can see why we just call it the thread lift, and that they are little things, little sutures, roughly this long, attached to a cannula, which is blunt-ended, placed through one entry port, usually 3 through 1 port, and attached using a twisting action, tighten using a pulling action, and then we just cut the ends of them and they stay there. They stay there for the period of time that they take to metabolize them, basically by the process of hydrolysis. Now hydrolysis, all that means is that these crystalline things, the poly-P-dioxanone, the synthetic polymer, is just degraded over a period of around 6 months or so. That just means it turns into water, carbon dioxide, so essentially it should just evaporate, for want of another term. That means they're very safe, but as with all procedures there are some contraindications. So that would be people that can bleed a lot, people that are on anticoagulants, people that have had threads before and had a bad reaction to them. The bad reactions would be very rare, and they would be things like granulomatous formations, so lumps and bumps. That would be something which you can't really predict. It's like a black swan event, and that could happen to anyone. But things that put you at more risk of that would be an autoimmune condition such as rheumatoid arthritis, SLE, or other autoimmune conditions like Graves' disease. Essentially that puts your body's white blood cells on high alert. It means that they're hyper-reactive, and that means that sometimes granulomatous formations will occur in these patients. It doesn't mean you can't have the procedure, it just means you have to be adequately counselled about the risks associated with the procedure. In terms of further complications, it would basically be not looking great, which can happen, and that could either be due to poor technical expertise, due to bad luck, due to anatomical variation, or due to misfortune such as a slip of the thread. If it does happen, it's not the end of the world. It just means that we may have to put another thread in, which of course will be done as a part of the initial treatment. The first appointment should be a consultation. The second appointment will be the treatment, usually 1 to 2 weeks apart, and then follow-up can happen anytime really. So if you need to be seen straight away, you'll be seen straight away, just to have your mind put at ease or to have something looked at. Usually people come in about 2 or 3 weeks afterwards, and then again about a month afterwards. Following on from that, presuming you don't have any other treatments, we'll see you after a year.